Your health tonight. There are still a lot of questions about how we should be living with COVID and vaccinating those younger kids. And the pandemic has also led to some children actually missing out on some of their more basic health care needs.
That's right. And to help us answer some of these questions and more, we are joined live by Dr. Monica Ghandi, an infectious diseases expert at UCSF. Dr. Ghandi, welcome back. Thank you for your time as always. Have you seen any compelling data that suggests it's beneficial for parents to wait maybe longer than the recommended 3 weeks to give their 5 to 11-year-old a second dose?
Yes, there are actually 3 pieces of data that have really convinced me we should wait 6 to 8 weeks between doses. One is immunologic. There was a Cell paper that showed if you wait longer, you're going to get better antibodies, but also better T-cell responses. Those are the long-lasting responses that we want kids to have. Second is data from Canada that showed us that if you give 3 weeks between doses, there's 82% effectiveness with the Pfizer, 92% effective waiting 8 weeks, and you want better effectiveness. And then third is that there's more cases of the mild heart inflammation, myocarditis, in Israel, where they did 3 weeks very strictly, than in Canada, where they did 8 weeks, about 4 times higher rate in Israel. So I personally have been advising and waiting for my own child for 6 to 8 weeks between doses.
And you have, I'm sorry, you have an 11-year-old, so that falls into that category. I have kids who just turned 5 and 7 who got their first doses yesterday. So, you know, these pediatricians are saying come back in 3 weeks, but you're saying you should push to extend it, and really that is your choice as a parent.
Yes, and that is actually your choice as a parent. That's a really good way to put it. I wrote a Time piece in the magazine Time with a pediatrician, where we laid out all the reasons why we recommend prolonged spacing. Sometimes what the CDC ACIP does is they kind of listen to the pharmaceutical companies' data, but there's such compelling reasons now for me to recommend to you parents that you extend the duration between doses.
What would you tell parents who are nervous about giving their children their first vaccine?
It's true that this is a new vaccine and that feels hard. And some parents want to wait for more safety data. I will say that this is a really small dose. It's 10 micrograms as compared to the 30 micrograms that are given to adults for the 5 to 11-year-olds. I feel really safe with that dose personally as a parent. It also, in the 2,268 children studied, half got the vaccine, no safety concerns with myocarditis or anything else. And again, I think safety can be better with longer spacing. And I understand that some parents want to wait, but there have been deaths from COVID-19 in this country with children. Absolutely, it's much less, your child is much less at risk than adults. But any death is tragic in a child from a preventable illness, and that's why I recommend the vaccine.
So you think the risk is worth it? Obviously, the vaccine for kids is a bit of a risk, but obviously COVID for kids is, you think, much more of a risk, and that is why you're telling parents to get their kids vaccinated. Now, what sort of metric or what percentage of kids in a given classroom need to be vaccinated in elementary schools for them to be able to safely remove masks?
Well, I think that's a great question. And in a way, right, public health officials are making all of this up as they go along. Like 1918 was the last time we had a pandemic, and there were many classrooms that just used ventilations and didn't use masks. So we have to just remember that, like, we just have to come up with something clean and understandable to parents and say that's when your kids get to remove masks. Because why? Trying to motivate vaccinations. And if you want to motivate vaccinations, telling children that they can act like 19,000 people in the Chase Center who are all together, is very motivating because adults are back to relatively normal life. So I would say 12 weeks after the availability of the 5 to 11-year-old vaccine. I wouldn't tie it to a specific percentage, but the availability so that every parent can feel safe that they can get their child vaccinated, and then it could be mass optional.
Well, that's motivation. We're really short on time, but I do want to address the fact that, you know, a lot of kids are falling behind in some of their other vaccinations, like for measles. Are we going to see now, you know, measles making an ugly comeback?
I have to say I'm very concerned about this. The CDC reported, and so did WHO, that there's been a massive reduction in measles vaccines. 2 million children in our country didn't get their second dose. We are very worried about loss of control of measles, and that's the risk of any pandemic. We have to now start concentrating on other infectious diseases as we live with endemicity with COVID-19.
All right, Dr. Monica Ghandi, unfortunately, we're out of time. We appreciate yours, no doubt, an infectious diseases expert at UCSF. Have a good night.
Thank you,
Thank you.
Doctor.